Welcome back to the Topics in Radiography podcast. I would like to talk to you about something today that was brought up by one of my Facebook followers. As I said in my last podcast, I really like to kind of get the feedback from the community as far as what you want to hear about. And this is actually a great suggestion. It comes from Tara Poole. She submitted this through Facebook to me, and it's something that I've often struggled with myself, especially as a new technologist. And even today, if I were in an X-ray department today and it got busy, it's one of those things that you just really have to prepare ahead of time to have an answer for. And that is really, how do you explain radiation dose to patients? Patients will often say, is this dangerous for me? How much am I getting? And, you can quote all of the CVERTs or RADs to them that you memorized in school or may have forgotten since school, but it's not really going to make much sense to a layperson who doesn't understand that terminology. What they're really looking for is kind of a comparison, and I'll explain a little bit more about that later. Keep in mind that this is just something that you should take seriously. A lot of techs tend to kind of roll their eyes when patients ask about how much dose, and it's just going to make my day longer or this patient's exam longer. But really, if you just act dismissive about this kind of thing, you're probably going to upset your patient. Some people like to say, today's x-ray is going to be like sitting out in the sun for an hour. Well, that might not be entirely accurate, and it might cause some concern for somebody. I'm not out in the sun a lot myself these days. If I sit in the sun for an hour, I'm going to get a sunburn. So a patient could look at that and think, I certainly don't want to get radiation burns. So how they're interpreting what you're telling them dismissively is important to consider. I'd also like to provide you with some resources. You can always have like something written down to refer to if you have the ability to do a quick web search while the patient's in there and show them, or at least give them the websites they can look it up on their own if they don't really want, or if you don't have the ability to keep them there looking on the internet within the hospital room. There's a few things that you can give them that kind of relate it well to terms that they understand. I'd also like to just kind of go over some of the basic patient needs and why it's important for you to know them. Basically, you are a patient advocate. Whether you feel that way or not, it's your responsibility to stick up for the patient. How often do you see doctor's orders that might be for an incorrect exam? Or if the patient's pregnant and they've ordered all these radiation-causing tests, and you know that there's either an ultrasound or MRI exam that could give the same diagnosis for what they're trying to rule out, that you might want to bring up to the radiologist. Obviously, you can't make those changes, but you can inform the radiologist the patient's pregnant, and I'm sure your hospital has a policy as far as what to do with pregnant patients and making sure they're getting the right exam. Finally, I really want to provide you with a strategic approach to communicating with your patients about radiation risk. So let's just kind of jump in with a statement that may kind of put this whole discussion into perspective. And that is that your knowledge of dose limits and radiation exposure is going to be different than just about every patient you have. So the amount of information that the patients walk through the door with could vary. You could be x-raying a physician, you could be x-raying a 2-year-old. Not that the 2-year-old is going to ask you about dose, but let's say a teenager might start asking questions like that. Maybe they've seen Dr. Oz, who knows. Or you could be x-raying someone in the medical field who has some kind of amount of radiation education, but is showing a little reluctance or just looking for more information about their specific exam. Patients aren't going to stand what you mean if you start talking about terms like millirads or millisieverts. They're not going to understand stochastic and non-stochastic effects, and they certainly don't know what the law of Bergonier and Tribondieu is about. So our first resource I'd like to talk about is more of something that I'd like you to go and just take a look at, read through. There's even a thing that you can sign saying, I agree as a professional who administers radiation to patients, that I am going to abide by these standards, and this is called Image Wisely. If you've never heard of this, I'm going to put the link down in my show notes. Image Wisely is a resource for adult-based exams, and there's a pediatric version of this as well called Image Gently. I can put that link in my show notes as well. The pediatric version, you may talk a little bit to parents about these radiation dose risks, so it's worth a check. I want to mainly focus on the Image Wisely, the one that's made for adults, because you're going to be having probably more in-depth conversations with adults who are getting a lot of imaging exams who are concerned about their dose limits. This site, after looking at it, I believe serves as a good refresher for someone who is a radiologic technologist. I think that the information might be a little too technical for some of your patients who haven't had any sort of exposure to radiation protection guidelines or dose limits or anything like that. It's great for a review for you, so I recommend it for the average technologist as well as any X-ray student who may not have had this in school yet. They put it in a pretty simple and understandable format. And some of the useful things that they include, I thought was great, was one is a section on the probability of death from various injuries versus radiation-induced death. We all know that there's risk of dying via car accident or lightning strike. So they kind of go into the quoted statistics of how rare is it that you might die from something like that versus the type of X-ray exam that you're getting. To me, that's great because it puts things in relatable terms that are easy to understand for just about anybody. And I think the reason that I recommend going here first over my next resource is there's two useful tables there that I just think are amazing as far as kind of getting your mindset into answering questions from patients about their dose. The first one is in table 15. It's on this website. You got to scroll down a bit, but this table is very useful in comparing a particular type of X-ray exam to the time equivalence of natural background radiation exposure. And that's a way that I like to kind of, communicate to my patients is that you're receiving natural background radiation from the earth and from the atmosphere every day. So obviously we're giving you more, but the amount we're giving you with this medical test is comparable to how much radiation you're receiving just from going about your everyday business without getting any additional medical exam exposure. I think a lot of people relate to that. It's easy to understand. So look at that table. It's in table 15 again on the Image Wisely site. So I'm going to go a bit backwards here. I went to table 15 because I thought that was kind of the best first place to go. But the final thing I'd like you to look at on that site is table 13. So you have to scroll up a little bit from where you were. And this is a checklist of do's and don'ts when communicating patient risk. For instance, table 15 has a comparison chart. A PA and lateral chest x-ray is approximately how much time you would have to just absorb natural background radiation compared to getting this x-ray exam as 2.4 days from the PA view and 12 days from the lateral view. And that puts it into perspective to me. I mean, that's pretty easy to understand. So table 13, if you look at the page, it's got, the category. It's got things listed like, I'm just going to, go over a couple of them here, but there's a list of things. One thing is like truthfulness. So do you tell the truth? Do not lie or avoid the truth. Absolutes. I'm thinking of a Star Wars reference right here, where Obi-Wan Kenobi says, only the Sith deal in absolutes. And, the statement, the very nature of that statement, when you use the word only, is an absolute itself. So he's kind of self-contradicting himself. But sorry for the little tangent here, but it's just a little bit of the nerd in me. But back to the checklist, avoid absolutes. Nothing is absolute. We operate on if you remember, the linear non-threshold dose response curve, where any amount of radiation has the possibility of producing an effect. So don't use the term never or always. And these are just the top two in this list that they've got on table 13 in the Image Wisely page. These are great. There's a bunch more of them. Just kind of get your mindset going before you jump to the next resource. This is a good starting point. Okay, so the next and my favorite resource to refer people to is called xrayrisk.com. And again, I'm going to put the link in my show notes. This site is supported by the ASRT, and what's great about it is you go to it, and on the very front page, there's a giant button in the middle of the page. It says Calculate Your Risk. So you push the button, it takes you to a new page, and it's got all sorts of different exams. There's some common x-ray exams, but it also has, mammograms. It's got extremity, every type of x-ray thing, every type of x-ray exam you can think of. And then below that, there's some options for CT scans, a few different fluoroscopic studies, nuclear medicine and interventional procedures. And then it's even got a little MRI and ultrasound section that indicates that, that there's no ionizing radiation being produced during those exams. And it just kind of talks you through that. It's much geared towards the layperson and in easy to understand terms. And this is the site that I was mentioning earlier that, if you're trying to put the patient at ease or give them more information to make a sound decision, that you could pull up in the room with them before you have your exam, and obviously I want to caution you here. Let me just take a couple seconds to stop and caution you, because you're providing this information. This is all estimated dose information from various sources here. This is not the exact dose that they are going to receive for their particular exam, and you need to be upfront with them about that. So again, tell the truth. That's going back to telling the truth. This is just on the average patient size. I'm going to get into this a little bit more later, but please don't act as if you are the final authority on this. If they have really specific questions that are not answered by any of these resources and that you are not comfortable answering, always defer to the radiologist. You can ask the physician to come in and speak with the patient. That being said, use these resources to the level that you're comfortable with and that fall within your scope of practice as a technologist. If you're licensed already, you're going to know where that scope of practice begins and ends. So stay within that realm. If you start to stray outside of that, don't go into that danger zone there. You're going to get yourself in a lot of trouble potentially. So use the radiologist as a resource. So that disclaimer out of the way. Depending on the exam you choose on this website from that little pop-up menu, it allows you to put additional information about yourself. Once you select an exam, it's going to ask, are you male or female, the age at the time of the study, potentially number of exams you've had, and a few other details that would help the site calculate an approximate total effective dose. And that also gives you something really cool specific to this site that says additional cancer risk. And I think that's really kind of what every patient wants to know. Am I going to get cancer because I'm in here having a radiation dose? Now, you may have some patients that interpret this in different ways. Some people are going to look at it and say, oh, that's pretty low risk factor. But some are going to say, oh my God, this is going to increase my risk for cancer. Is this a necessary risk? And if they start asking you those questions, that is the point when you need to put on the brakes and say, I really can't answer that for you. I'm not qualified to. The risks versus needs of the exam should be a conversation between you and your physician. Say, I'm more than happy to do this now, or we can reschedule the exam if you'd like to get more information, or even if you'd like to have the radiologist come discuss with you. There may be some questions they can answer for you, but that is a conversation for your ordering physician, whoever ordered this exam, and you to have. Don't make any attempt to make that decision for them or help them iron it out in your exam room. That's out of your scope. There's another section in here that has another excellent tool that basically is exam dependent, and it compares doses to non-medical sources of exposure and risk. Similar to the other site, the Image Gently, this site has a comparison to natural background radiation, and it also goes into things like the average U.S. exposure. So this obviously is a site based out of the United States. Exposure received by domestic pilots. The pilots or anybody, anytime you're taking an airline flight, which is another category that they compare it to, you do receive a little more radiation because you're higher in the atmosphere. They have the comparison of taking a 7-hour airline flight versus exposure received by a domestic pilot, somebody who does that for a living, who receives a certain amount of dose every year, similar to a medical radiation healthcare worker. You have dose limits just like the pilots do. There's also comparisons to other exams like CT, fluoro, nuke med, interventional procedures. And it's also got what I think is a little bit more easy to understand risk factor association. So estimated lifetime risk of death from various sources like MVA, motor vehicle accident, drowning, having a bicycle accident, lightning strike, and then the overall lifetime risk of developing invasive cancer for men and women regardless of imaging history. This section does not take into account considerations for risk factors like lifestyle and genetics. Again, depending on how much time you have to go into all this with the patient is one thing, but I suggest go into this like now or at a time that you have that is outside of the clinical environment, or even if it gets slow. This is something that you want to again prepare yourself to have a conversation with the patient. You can write a few of these figures down if you like to, provide just a little bit of this, but this podcast is mainly to provide you with a list of resources so that you can be prepared. I would advocate against trying not to have this whole research being conducted by you in front of a patient while they're asking, but try to look into this before someone asks you this. This site, again, this is a great site. This is my favorite one, this xrayrisk.com, because it also has a handout. You can print as many of these as you want. There's a PDF copy. I'm going to put the link directly to the handout in the show notes here as well. Empower your patients. Be that advocate. Your patients should be making some decisions for their own care, not having you coerce them one way or another. And if they're uncomfortable given the amount of information at their disposal, you can provide that information for them, or at least direct them to a resource that can answer their questions. Your job is to explain what you can, not in exact amounts or exact risk, but to provide estimates if needed in relative terms. You want to explain things in relative terms to the layperson. For instance, taking from this xrayrisk.com site, it says a chest x-ray equals 0.1 millisieverts, and natural background exposure equals 3.1 millisieverts per year. So you're not going to actually tell them that, but what you're going to do is kind of think of this in your own mind. In other words, the amount of radiation you receive from normal everyday activity in 1 year would be the equivalent of 31 chest x-rays if you actually did the math there. Or, there's another comparison that we mentioned earlier, airline flights. 0.02 sieverts are received from an airline flight. I believe that's the 7-hour flight as quoted before, or you would receive the same dose from radiation from 5 airline flights that you would having this chest x-ray. So in essence, there's a little bit of research you need to do yourself, and all of this information helps you to discuss radiation risk with your patients. Every once in a while, like I said, you're going to run into those patients who have some kind of prior education about radiation. For these patients, it's probably best to just refer to the radiologist. See if you can get them to come in and chat with the patient, because they're probably going to look at your layperson resource and maybe feel a little insulted, or you have no idea what background they have unless they tell you. Just not to leave out any of those highly educated patients you may have who may be looking for resources. They might not be aware of everything at their disposal. There's one more source I'd like to discuss with you, and I'll give you the link as well. The EPA actually has a great radiation assessment website. It's highly technical. A lot of it's over my head. I think you really need to have a physics background or dosimetry, somebody who's very knowledgeable about dose risk and calculation, in which case they may not have too many questions for you, but I like to be prepared in any case. They actually have some downloadable software called DCAL that calculates dose risk. And again, the only reason I'm mentioning this is because I want you to be prepared for every type of scenario. I would really avoid too much conversation about radiation risk with someone who is highly educated, probably knows more about it than you. Just your best bet is to offer to have the radiologist come in and have a discussion with them. They may ask you, how much radiation am I getting from this? And while a layperson may ask you this, what a layperson is really asking is what's the risk of developing cancer, or is this going to damage me? This particular type of patient they may actually want to know the dose. And depending on the systems you have set up, the new digital equipment has dose area product calculation. There's a few methods that can be utilized by a radiation physicist to calculate the amount of dose that is received per exam. If you run across one of these patients who absolutely wants to know that particular dose, and don't question their reasons, it might just be they've had previous cancer or they've just had a ton of exams, CTs or X-rays for any particular reason, you probably would see their history on the requisition, but you can still provide that for them. It doesn't come directly from you, but your hospital or your hospital system is going to be able to provide either a physicist that can calculate that for them or the radiologist can do it. But they're going to need some factors from the exam. So try to remember those technical factors and jot them down on a piece of paper as quickly as possible. But your physicist can actually take whatever information that's provided in the DICOM header. In other words, every time you take an image, there's certain information about the exposure factors in that particular exposure, and they can calculate the actual dose. But it takes some time for them to do that. You may offer to take their information, contact information, and tell them that you're going to forward this to the radiologist or physicist, and they can call you, or you can call them with the information. Try to get the physicist to call them back, because if there's follow-up questions, you're basically going to go through the same routine of, hold on, let me tell the physicist that you have another question. You don't want to be the middleman in that kind of situation. In any case, I'll put the link for the decal software from the EPA website. I haven't looked at the software myself. I really don't desire to. It looks pretty technical, but it might be a good resource to just give to any of these patients you run across with high technical knowledge. So in closing, all of these methods are an estimation of dose. Please stay within your scope of practice as a technologist. If you're a student listening to this and you're not sure where that lies, of course, bring the staff tech in there that can help you out. Really hope that you guys, feel comfortable coming to me with topic ideas and suggestions. You can check out my website at topicsinradiography.com. This particular episode is episode 002. So if you're going to search for it on my website, it's going to be at the homepage for a little while, but you can type in, there's a Google search bar on my homepage, TIR002, and it should be the first one that pops up for you. You can now find my podcasts on iTunes, as well as Stitcher, and a bunch of the other directories that I'm forwarding everything to. Pretty much any podcast player that's out there that there's an app for you, I'll be searchable on there for you. So again, thank you for listening, and I will catch you next time.